Natal, where that group of unemployed doctors are staging a sit-in outside the office of the Premier in Pietermaritzburg. This is over vacant posts in the health sector. Today's sit-in is their third protest action since January, aimed at highlighting not only their struggle to find jobs, but also the broader crisis in that sector. Newzroom Afrika Silethiwe Ndlovu joins us live from there. Silethiwe, good morning to you. What are these doctors protesting for?
Well, there's a number of issues, Stephen, that they are protesting for, and perhaps to get a better perspective in terms of what they are protesting for, I'm just going to bring in Dr. Hussain, who is the chairperson for Employed Doctors. I just want to start off by talking about your concerns. We were just talking about this of a memorandum after memorandum, but here we are once again faced with the same issue. Just talk to us about some of your concerns.
Thank you very much, Newzroom Afrika and our listener. We have been informing Department of Health and the national government, provincial government, that junior doctors after community service, they are unemployed. And memorandum after memorandum, meeting after meeting, nothing is happening. And especially in KwaZulu-Natal, the fund is allocated, billions of rand was given. They haven't done any advertisement for junior doctor posts, including the junior consultant. And the doctors are unemployed. Hospitals are overburdened with the disease. Patients are suffering. Community is getting in the hospital 4 o'clock in the morning, and they've been seen by 1 or 2 doctors working in the hospital, and there's no medication as well. And they're going with the sickness from one hospital to another hospital, and the same crisis. It's a crisis of a doctor, crisis for the patient, and they're unemployed. You know, after qualified as an intern and com service, remain sitting outside. Now we are sitting in the street. They're supposed to be looking after the patient and cure the patient, but it's not happening. And government is just putting deaf ear, and the health is not giving priority.
And actually, that's my next question. In terms of the budget, the health budget that has been added, 28.9 billion. Other provinces at this particular point have already started advertising. KZN at this point being the only province. Maybe just talk to me about that.
Yes, in KZN, the vacancies are there. What they're doing, when somebody resign or getting off from the post, they're showing in the computer 0 vacancy. So they say, we don't have a vacancy. That is not true. The huge vacancies are there in every hospital. They are working minimum critical level. For example, if some hospital there was 20 doctors, there are only 6 or 7 doctors running the whole hospital. And the other tricks the Department of Health doing, especially provincial hospitals, they're using intern as a workforce. Interns are not running hospital. They are under supervision and training. So they need to be changed, and they need to employ all the junior doctors. And the budget is there, money is there, mismanaging. We don't know where the money is going and not putting in the health.
Are we saying that this is perhaps a provincial government issue?
Yes, provincial government, we had a meeting with the HOD last year. They promised that we are going to advertise post and all the doctors will be absorbed, but nothing happened today. And even the President Ramaphosa announced in in the election rally that he will absorb 800 doctors in Durban, he announced, but not a single junior doctor has been appointed till far. What they're advertising is NHI post. NHI post is a part-time sessional doctor post. It's a 4-hour job. It's not a full-time job. There are no pension, no leave, nothing, no maternity leave. So how can a junior doctor survive on that?
And lastly, before I let you go, I know you're mentioning the implications. You're talking about different hospitals being understaffed. But I just want to look at the pool of doctors that we're about to see graduate. They are essentially going to join these post-community service doctors that are yet to receive employment.
Exactly, you are very much correct. At the moment is 800 unemployed. It was 1,800 throughout the country. In KZN alone, this year is almost more than 100 unemployed now. And another batch will come, like 2,400 community service will be qualified end of December. They will be also joining. So the number will be increased 100 to 200 and up to 500, maybe 1,000. And they say you must go and do the public sector. Or ministers said you must leave the country and go look for job overseas. Why they have to go for another country to work? We are trained here, taxpayer money was given, and we're supposed to be looked after in our own country. So the number is just increasing, and I think this needs to be resolved as soon as possible. I think next 24 hours or 48 hours, the MSC and the Premier must intervene. Otherwise, we will take this action further.
Dr. Hussain, thank you so much for speaking to us this morning. That's Dr. Hussain. He is the chairperson then for Employed Doctors, speaking to us about the implications when you are looking at unemployment, but also touching on something that is quite problematic. The health budget has been added, 28.9 billion, but KZN remains as the only province that is yet, it seems at this point, to advertise some of those vacancies. But later on, Stephen, we are going to get in conversation with some of those doctors and speak about more implications when you're looking at this issue of unemployment.
Thank you very much indeed, Silethiwe Ndlovu. Really appreciate that update. A lot going on there, of course.